Hey everyone, I hope you all are doing well. So today we will be talking about the nursing responsibilities that no one really talks about. So I think most people think that when you become a nurse, it's all about just, going to the hospital, taking care of your patients, and then going home. Well, I'm here to tell you that that's not true. So it used to be kind of like that, but now more units want you to be involved on your unit. So how do you become involved on your unit? One way is to join committees. So in my unit we have things like the pain committee, the bereavement committee. So you just join a committee, you help out with that to just improve things on your unit. Another responsibility that we have on my unit is to read 12 journal articles every year. They just kind of want us to be aware of what's going on in the nursing world and to share it with our peers. So one way that we share it with our peers is through like a little peer review type thing. So you just read an article and then you present it to 2 or 3 of your coworkers and just have a little discussion about it. Another requirement is that we attend staff meetings. So when I was a CN1, I think I only had to go to half of the meetings. We usually have one meeting every month. Now that I am a CN2, I think I have to go to 75% of those meetings. And it's pretty simple. You just call in or you actually go to the conference room and listen to what they have to say. Of course, this is important because this is where they discuss any changes that are going on with the unit. So it's important to make sure that you're in the loop and you know what's going on. Another responsibility that we have as nurses in most states, not all states, is to keep up with CNEs. Those stand for Continuing Nursing Education. So basically if we have like an in-service on the unit or something like that, it can literally be less than 30 minutes or maybe it can last maybe an hour. But you will get CNEs for participating in that, and it's basically just like a little session where you learn about something that you use on the unit and boom, you get a CNE for it. And so some states require you to have a certain number of hours so that you can renew your nursing license, and sometimes you have to have a certain number of CNEs when you do your evaluation at the end of the year, so it's important to keep up with those. Yet another thing that we have to do as nurses is to keep up with online modules. So you basically just log into your account online and you have to complete these little modules. Sometimes they're like 2 minutes, sometimes they're like, 30 minutes or longer. So basically these modules can be things like fire safety, active shooters, how to use the glucometer, just anything that the hospital or your unit will be using so that you know how to use it, why you use it, what it's for, and things like that. And we do tend to have quite a few throughout the year, and they usually have like a deadline, so you have to have them done by a certain date. One other responsibility that I was not aware of before I became a nurse was the nursing evaluation. So every year you have a nursing evaluation with your supervisor or CN4, whatever you may call them on your unit. So yeah, I knew nothing about this. So they basically evaluate you. You have to do your own self-evaluation to see how you think you're doing, and then your CN4 will also rate you. So these are important because it kind of determines how well you're doing on the unit. Are you active enough? Are you learning? Are you participating? Do you meet the requirements that they have on the unit? Are you going to get a pay raise? Things like that. So usually before the evaluation you may have to complete some competencies. So these are based on your unit. So in the NICU we have competencies relating to how to properly wash our patients, how to do a code navigator. So it's basically like a mock code. You just practice recording or documenting what happened on a code, so that way you know how to do that. We may have to write like a little paragraph about lateral violence. So there's just quite a few competencies that you have to complete before your evaluation. So I'm obviously not sure how it works in other units and other hospitals, but for the most part that's what we have to do on my unit. And I know other units in the hospital actually have competencies too before their evaluations. So I have been told that my unit tends to require more from nurses than other units, and I've heard that from other nurses who have worked both on my current unit and on other units or different hospitals. So, the amount of work that you have to do, I guess, depends on your unit or hospital. So you may be wondering, why do I have to do all this? Why can't I just come to work, take care of my patient, and go home? Well, I wonder the same thing too sometimes, but that's just the way it is. You know, they really want you to be active, and all these things, like I said, they are related to your evaluation. And if you want to have a good eval and possibly get a pay raise or get promoted to like a CN2 or a CN3, these are things that you have to do. So I just wanted to point out that it's not all about just patient care. You do, for the most part, on a lot of units, have to be active on your unit. That was just a general overview. If you have any questions, feel free to leave a comment. And I hope you all have a lovely day. I'll catch you guys in the next video. Bye.